can you make sure that your hormone therapy after menopause is absolutely safe for you? That it's not going to increase your risk of cancer, it's not going to increase your risk of a cardiovascular problem, that it's not going to increase risk of weight gain, that is not going to cause any trouble as far as abnormal bleeding, creating risk of uterine cancer, hyperplasia, which is excessive growth of the uterine lining. There's so many things that can happen when you do hormone replacement therapy. Testosterone, if it's too much, you can have hair loss, hair growth. You can experience all kinds of acne, water retention, hoarseness and changes in your voice, excessive hair growth on the face. I already mentioned that, but that's something no woman wants to see. And long story short, how do you know? Well, as it turns out, 80 to 95% of patients, at least from my experience, and I don't think anybody looked at this statistic, rely on their doctor to manage their hormones and to make sure they're kept safe. But in today's day and age, when you go to see a lot of doctors, you have a hormone doctor, a heart doctor, a joint doctor, a primary care doctor, an orthopedic doctor, and who the heck knows what other type of doctor you see. In a nutshell, your hormone doctor might not be the only doctor that's taking care of you. Obviously, there are patients whose other doctors don't even know that they're doing hormone therapy because they're very judgmental and they've already said hormones are bad for you, and patients are like, okay, I'm going to go do hormones anyway because I love hormones and I can't live without them. So they just stop communicating that to their doctors. So I think that if you understand the whole concept, your primary care doctor and your gynecology doctor, you really have to have a close relationship with, regardless of who your hormone doctor is. Because your gynecologist needs to be in charge of your breast health and your pelvic health. And that means uterine surveillance with an ultrasound once a year. I talked about this in the past, and it's priceless in how important it is to do an ultrasound, regardless of the patch, the gel, the pellet. It doesn't matter what you're doing. Once you introduce hormones in your body, especially estrogen, you need to have an ultrasound once a year. And I'm really hoping that this will become standard of care going forward, as more and more women are now interested in estrogen. And with the removal of the black box warning of transdermal and vaginal products, everybody's excited. Well, it's a mad rush to get estrogen. Well, even vaginal estrogen will cause changes to the uterine lining. So you need to keep an eye on it once a year. You also need to have a breast exam once a year done by a physician. Do not rely on a mammogram once a year. 10% of breast cancers are not picked up by mammogram. You need to actually have a physician in the office examine your breast.